Hello everyone, welcome back to this time the last Science Night COVID special. It's not going to be the last Science Night, so don't you worry. We're going to have more Science Night, but we need to figure it out what will be the format, but we were already talking at probably like November or something we can have and start talking again a little bit about science. This time hopefully not COVID or so heavy on COVID anymore, so things will be better and we have other interesting topics to talk about. So tonight, as I said, we're gonna have our last COVID special, and this time is going to be given by my colleague and friend, Dr. Neha Mishra. We work together, and Neha will be talking about long COVID tonight, so I think it's going to be really, really interesting, and we also kind of have a little bit of a look at what's going to be in the cards in our future, and also what the scientists of Kiel are going to be doing. So thank you very much for joining us, Neha. You can maybe introduce yourself first, and then we can start.
Okay, hi everyone. I am Neha Mishra. As Joanna said, I'm a colleague of hers. I'm a postdoctoral researcher here in Kiel at the UKSH. And now, as we all have become, I'm also a COVID researcher, which is obviously new for all of us. But I started actually, my PhD was in evolutionary genetics. I did that in Japan. And then I moved to Germany. Since then I've been working at the UKSA, and now I'm also working in COVID. Today I'm going to talk about long COVID. So we have already had talks, wonderful talks in Science Night before about the clinical symptoms and course of the disease, which was given by Dr. Florian Tran in the first talk, where he discussed about what are the symptoms of the disease, how you can get it, and then how severe or moderate these courses are. Then Joanna gave a talk, next was about the host immune response of SARS-CoV-2, which is the virus that gives you COVID-19. And she talked about how it enters your body, how it attaches to cells and goes into the cells, and then how your body reacts to it, which in the end causes all the symptoms that you see in COVID-19. And then last week we had a wonderful talk by Dr. Tim Holstein, which was about diabetes and COVID-19, and then where he showed that diabetes is not only a risk factor for COVID-19, but also kind of a byproduct, let's say, of COVID-19 sometimes. And this is actually a little bit where it connects to the long COVID part. So long COVID is something that happens after you have had COVID-19, and in the last talk by Tim, he did discuss about the occurrence of diabetes, which was similar to type 1 diabetes, which happens after COVID-19. So to just give you a recap, which you already know since people have discussed it here, that COVID-19 or the acute COVID-19 diseases, once the people that get it, can have a very different or very heterogeneous disease course. So most people who get COVID-19 have mild symptoms. They probably don't have to go to the hospital even. So in this graph, if you see with the COVID-19 severity, they lie somewhere here. So they might have some symptoms, or they could also be asymptomatic, and then they would get better and so on. And then some people get severe who have to be hospitalized and given some supplemental oxygen, for example, and those would be around 15% of the cases. And these people are hospitalized, and then of course they have a very severe disease, but most of them do recover from COVID-19. And then in some cases you have very critical disease after hospitalization, and then a very few proportion of those people do pass away with the disease. But in general, if the people who do recover, or the patients who do recover from the disease, the whole course takes around 2 to 6 weeks, and from the starting of the symptoms to you being now negative for the virus and trying to resume your normal life.
Can I ask a question?
Yes.
So how is the virus throughout the disease? Does the amount of virus in the body changes?
Yes, it does. So which I will discuss in a couple of slides, the viral load does change within the body, and you can still have symptoms without the virus. You can have no symptoms but still have some virus, and we will talk about it a little bit. So these are this is like how we recover from the disease, but in some cases you could have, or the patients could have long COVID, which has been in the news and you might have heard about it. It doesn't have a very clear definition so far, but in general what it means is that the patients have not recovered for several weeks or months following the start of the symptoms that are suggestive of COVID-19. And this in the end decreases the quality of life of these people. They can't go back to their normal activities very quickly. So again, talking about the timeline of the disease, and also answering Jonah's question, like what can happen is like you've been exposed to the virus, right? And in the beginning you might not have symptoms, but your virus is already in your body and it is replicating. So you have some viral load but not many symptoms. And then when you start getting symptoms, you get tested, and at that point you will be tested positive for the virus. So you will be PCR positive. And of course the virus can go to different parts of the body. So it can be either in your respiratory tract, which is your lungs in this area, or in the nasopharyngeal tract, which is where it lasts longer. So then for a couple of weeks you would have the virus or enough viral load in your body that you would be tested positive whenever you are tested. And then slowly the viral load, as your immune system fights against the viral load goes down. But you might still experience some symptoms until it's totally gone. This is what is called acute COVID, when you have the infection, right? You're infected by the virus. This is acute inflammatory immune response from the body, and you have the symptoms, and you're also positive for the virus. But in some cases, even though now the virus has mostly left the body, you might still experience symptoms for much longer time, sometimes until 6 months. And this is what is called long COVID or post-COVID-19. This could be one of the two ways. So either you never fully recovered from the disease, so you still have ongoing the same symptoms that you had during the disease, or you kind of recovered, but it comes on it's like a recurring episode that you have of those symptoms. And these symptoms can vary from anything between fatigue to like breathlessness or dyspnea or cough, or even like chest pain or more neuropsychiatric symptoms as well. So we talk about the symptoms now in more detail. So there have been some studies, mainly surveys, that kind of check the patients who have been infected with COVID-19, that how they feel. They ask the patients how they feel after a while, up to 6 months. And that's what they have realized, that there are many symptoms that they are present in the people with long COVID. So it depends, of course, how severe you had the disease in the beginning. So then you can classify the people whether they were hospitalized or not hospitalized. But one common factor, and what many patients report, is fatigue. So whether you were hospitalized, that means you had a moderate or mild disease, or you were not, whether you were not hospitalized, which means you had a moderate to mild disease, or you were severely ill and hospitalized, people do experience fatigue for a longer period of time, even when they are, negative for the virus.
And this fatigue is just they're tired, they cannot like do their normal lives?
So it depends. There's a degree of it. You could just feel tired, like when you go running, you are not able to run, or you get tired soon. But in many cases, or in some cases, there could be varying degrees of it. Like people are not even able to get out of bed. They are so fatigued, they are so tired that they can't even get out of bed to just drink a glass of water. And there have been instances of patients reporting that kind of fatigue. And so all of these symptoms do have a degree of severity, and that can also vary between individuals depending on many things we don't know yet. So that we don't know yet. But yes, there is a whole spectrum of this thing. Now, another thing that many people report is this pulmonary symptoms, in which they have like chest pains, they have breathlessness. So when they try to do some exercise or whatever, they can't breathe anymore. And also in some cases, they have these psychosocial or neuropsychiatric disorders, like they would have anxiety, depression, PTSD, and so on. And this is even more in people who were hospitalized. during the disease. And also in people who were hospitalized, they can also have some neurocognitive symptoms, which means that they forget stuff, right? And they are not able to, there's a memory problem, they have memory impairments, or they have concentration impairments. It's also called like being fuzzy and so on. So that's also something that is very severe and very important for your daily activities. And people who had severe disease or had been hospitalized do report these things as well. And this along with other different symptoms which can vary between people and depending on different factors. So then what is the pathophysiology of long COVID? Like, why do people still have these symptoms even when the virus is gone or has left the body? That's a very important question. We don't have a complete answer for this question, and that's why research is needed in this part. But there could be, or that's a hypothesis from the research community, that there could be some possibilities. First thing is that you can have some virus specific pathological changes. So once the virus enters your body or respiratory tract or your lungs or whatever, it kind of has to invade into the cells, right? And it can damage the structure of your lungs or of your organs at that point. So this is actively virus is causing this. The other possibility is that you could have some inflammatory damage. So once the virus is in your body, your immune system is now reacting against it. And as Joanna's talk also mentioned it, when that's happening, a lot of immune cells in your body circulate and goes to the organ where the virus is infecting. So in that case, even the movement of your immune cell can cause damage to your organs. So that would be the inflammatory damage. And then some cases, anybody who has been through a critical illness would expect some problems also, especially PTSDs and so on. It is a very traumatic experience. So those could also be responsible for the pathophysiology of long COVID.
So it's like, it could be the virus going throughout your body and like just can even be hiding and we cannot be able to detect it with a normal nasal swab. And then it could be also that your body is attacking yourself still because there was this thing.
Well, even if it is not continuously doing that, or even if the virus is not still there, but the fact that it was there and your body did do it can do some long-term damage to your organs.
Okay, and this is just the repercussions of what happened before.
Exactly.
Okay, so it's kind of like a scar that is still there.
Exactly, yeah. And we still don't know how long this could last. Would it repair, would it not repair, and so on. It's too early to say that, I would say.
Okay.
So of course I showed you all different types of symptoms that can happen in long COVID, and I will not go into each and every one of them because there are a lot of them, but let's talk about some common ones and also some interesting ones. So the first thing as expected is the pulmonary symptoms, which you have the problems in your lungs or the respiratory tract. And this figure here shows that the patients who have reported these kind of symptoms, so all means they have reported at least one of the following symptoms. So many people do report shortness of breath. As I said, they can't do their daily activities, they get short of breath, or they have cough or breathing difficulty. And then they could be sneezing or other respiratory or sinus problems and so on. And so why do we have these pulmonary symptoms? So in most cases it is a result of there is some damage in your lung itself. And again, coming from the proposed pathophysiology, as we just said, that when the virus kind of invades your epithelial or your tissue in your respiratory tract, it can damage it. Which could result in a long-term kind of a problem. Or it could be virus independent, in which your own immune system, the movement of your own immune cells is causing this problem. And in such cases, these things are managed so far, or how is suggested to be managed, is first thing is that we have to do a regular evaluation and assessment of how easy or difficult it is for you to breathe. So there are many parameters for that. You can have like a oximeter at home. You can see how much of oxygen you are able to use. You can also have, there's some tests like how much, how long it takes for you to walk, or how much you are able to walk in 6 minutes. I think it's called a 6-minute walk test or something like that. So you can do that. If it is more severe and you go to the hospital, they will probably take an X-ray of your chest or a CT scan and then see what is happening in the lungs. And in some cases, the patients are treated with corticosteroids or antifibrotic therapies, but these are still in the clinical trial phase, whether it works for this or not. So they are not like state of the art yet. The other set of symptoms that might be interesting for some people is neuropsychiatric symptoms. As I said before, that many people who go through COVID-19 can have cognitive difficulty, so they have memory functions, they can't concentrate and so on, difficulty in thinking. That's one way of having these kind of symptoms. The other is more like related to your emotions and your mood. So you can have anxiety, depression, apathy, and even PTSD in some cases. And one study which is from Wuhan in China actually showed that female survivors have a higher risk of anxiety and depression than the male survivors. We don't know why yet, but this is an observation.
Can I ask a question?
Yeah.
Sorry. So there's a lot of things that can be behind stress and anxiety and depression and even PTSD. How are scientists able to separate what is after having long COVID and what is just because of the times that we live in?
Yeah, so there has to be, they're really lacking research in this area. There has to be proper controls that you can compare to. And
what is a control?
Like the people who are living in lockdown in any case,
okay.
or the people who had the disease but did not experience these symptoms. So I will talk about it also in the end. But again, if you're able to kind of identify, because not all of these problems are just because of the PTSD, but sometimes it can be related to neuroinflammation that is directly connected with the whole virus thing. And if you're able to identify that problem, which is more physiological, then you can say, okay, this is because of this. But I think it is different from case by case, and you have to identify the problems behind these. So we need to understand the mechanisms of these symptoms if we want to make some conclusions about, you know, why is this happening? Is this really the cause of the virus, or it's just because we are living in lockdown and so on? But you have to also remember that even though we all are living in the lockdown, but the people who did have a disease have a harder time at it, obviously. And the many people who were hospitalized, it's like a traumatic experience, as I said, and they kind of undergo deconditioning or PTSD later. So this could also be this could also be like more pronounced in the people who had the virus than not. Although we, of course, being
it's not directly because of the virus, but it's because of the experience of having the virus.
Could be.
Okay.
Yeah. But we have to really do research to kind of identify the exact reason and the mechanism of these symptoms. Yeah, and so how these symptoms are managed is like some people are given standard therapies for neurological complications, or they have been screening for anxiety, depression, sleep disturbance, etc. And so that's how it's been currently managed. Unless we know the exact reason for this, there is no better way to do this. Instead of just, and this is for all the symptoms, you just have to screen people, you just have to like assess, evaluate what's happening, and so on. So then one question that is, I think comes to everybody's mind when they hear about long COVID, like how common is it? And that's what it came when I was trying to do the research to make this presentation. I was like, oh, is there a number that I can put on the slide that, oh, 20% of the people get it or 10% of the people get it? But that's what I realized after reading a lot of review papers and stuff, that it's actually very hard to say that how common is this. Some articles say it's 1 in 10 or 1 in 7, 1 in 3. We really don't know for sure. And this is also important to remember that the surveys and the studies where this data comes from. So many of these statistics, like this proportion of patients having these symptoms or not, they are mostly coming from surveys. So they are either telephone surveys, or when you go to the hospital, the doctor asks you to fill a survey. And they can have biases, because not only that, in many cases it's only the hospitalized patients that you are surveying, but also the patient who have the symptoms are more likely to respond to surveys. Like if you don't have the symptoms, you like ignore it, right? You won't do it. So that's why there is no proper control in this case to see. So they can have biases. But in the UK, they did this some time ago. They did like a survey of how many people complained about having some symptoms after COVID-19. So they found like 1 million, almost 1 million people have this issue, and more than half of those people have problem in doing the day-to-day activities due to the long COVID. And so I just want to say this, that we don't know how common this is, but this is not trivial. That in a country like UK, the 1 million people can complain of this, this is really not trivial thing. Then I guess the next question is like, who is at risk? That's also a very important question, which I would say the research is very, very preliminary right now. In that case, there's only like one paper that I found that actually looked into the risk factors, and in many cases the sample size is so small that you can't make any conclusions and so on. But this one paper that came from Wuhan in China, and they had a decent size of the sample size of the study. They found that in some cases sex and disease severity can have an effect on whether or not you can get those symptoms. For example, this first one is about the pulmonary symptoms, the problems in the lungs. They say here it's clearly that the people who had a more severe disease in the acute phase, so when they did have the virus, are at higher risk of having these post-COVID or long COVID symptoms related to lung damage. And sometimes a slight preference was also towards women, that women tend to have more of these symptoms than men. Then when we talk about anxiety or depression, these neuropsychiatric symptoms, again there was a high ratio of women getting it than men, very high. Actually, this was very significant, and this is also surprising in a way, because earlier there were studies, right, that said that women don't get that severe disease than men. So, but they do get these post-COVID or long COVID symptoms. And also it again depends on the disease severity that you had. But this data is very preliminary, and I would say that a lot of research is required to make any firm conclusions. But this is science, right? We evolve. This is all new.
Can you speculate why women are affected so much? It seems weird, because I would expect that the virus goes to the same places in the woman's and the man's body, and the response should be similar. Or is it the immune response also something that depends on sex?
It does.
Yeah.
So many diseases, many diseases actually tend to be very different between men and women. And there have been some studies in COVID as well. I think we attended a talk which focused on this. I don't remember the data right now, so I cannot say. But there are sex-based differences in many diseases, including COVID-19. And you cannot exclude that. How those sex-based differences amount to this thing, that I don't know. And I don't think many people know that, or anybody knows that yet. We have to investigate that. Yeah. But I also feel not to say that this is not important. It also could be a reporting bias. Mm-hmm. I don't feel that a reporting bias would be that much that it comes that high, but I would say that if women feel something, they might report it, especially when it's related to mental health mm-hmm. Than men. Maybe. This is just my speculation, and please do not take it as it is. This is just my idea, my thought. Yeah. But it could be, or it could be not. I don't know. So, as I said, a lot of research is needed into long COVID. There's so much that we don't know about it, and we need to know. So, first and foremost, there is not a consensus definition for what long COVID is. So I told you in the beginning that it's somehow when the disease or when the patients are not able to recover for a long time, for weeks and months, that's long COVID. But there is no consensus definition that, okay, so more than 6 weeks or more than 10 weeks or what, we don't know. Many people take it differently. Many studies also take it differently. So there has to be a consensus definition from the medical community so that more planned and nice studies can be done. So of course, and then we need a better quality of the epidemiology data. As I said, there has to be a proper inclusion of controls. Of course, you do survey the people who had the disease, who have these symptoms, but as a control, you also have to survey the people who don't have the disease but the symptoms, who have the symptoms, and so who had the disease but no symptoms, and so on. So there has to be a more efficient way of planning to actually know the cause of these symptoms. And then underlying mechanism is really, really important. As I said, unless you know what is the reason of something, it's hard to treat it, and it's hard to design effective trials. And this is very important, and so far not many studies have looked into it. Also, we should remember that COVID is new, and long COVID itself, because it's longer, so it's newer, and people and even scientists need time to do research. So I'm pretty sure there will be more and more studies coming in this thing. It's just that we don't have it yet. And WHO and other organizations are funding, having these. They are funding these studies which do this kind of stuff. Then also very important thing is to identify the risk factors for long COVID. Is if we could already know during the acute phase that this person or this patient is likely to have these long COVID, you could probably do something about it or plan better management of the disease than if you don't know at all who could or not. Of course, we know that disease severity might be one of the main reasons, so that's already a given, but there might be more things, especially when you're not that severe, because many moderate to mild people also get long COVID. So there is a need for further research, and there are a lot of ongoing studies around the world that are collecting data, trying to do research. So there's this PHOSP COVID study, which is in the UK, and they are studying like around 10,000 hospitalized patients. So they have a big cohort, and they are doing surveys and so on. And then there is this Link Sentinel, which is from the US. They are studying around 800 patients. And then they have this TLC study, which is again from the UK, which this one is actually focusing on non-hospitalized patients, because there's really a lack of observation or lack of studies that focus on the non-hospitalized patients. And in Germany also, there have been some studies. One of the study which we are going to be a part of in Kiel is a COVIDome study, in which we want to not only look at the epidemiological data, which we of course want to, but also the molecular, like the reason, the cause of those symptoms. And we have around 300 severe or moderate COVID-19 patients from Germany. Of course, this cohort is ever expanding as more and more data is being collected. And this is something that people or researchers in Kiel would be contributing in. So,
can I ask a question?
Yes.
About the COVIDome study? So what is the planning? Because you talk about the importance of controls. Are we including any type of controls in this?
So we have some severe patients, and most of them have had one or multiple long COVID symptoms. As I said, if you had a severe disease, they're more likely to have long COVID symptoms. But we also had some moderate COVID-19 patients, and some of them had it and some of them did not have the long COVID. So that would be an interesting group to compare, that what is actually underlying the occurrence of long COVID symptoms, even though they had the similar type of disease during the acute phase.
Okay, it's interesting.
That's very interesting, yes.
Yeah, I think it's for now.
And one of the amazing things about long COVID, so I did not tell this in the beginning, but long COVID, the term is actually not coined by the researchers or the medical community. This has been coined by a patient who was trying to share her experience on Twitter, and then she coined the term long COVID. So even the patient community or the patient advocacy groups have been very active in this research. And there are many of these groups, which is kind of a silver lining because they kind of do a lot of surveys, they kind of report many symptoms, they also do patient-led research for COVID-19, and also kind of a support group for the people who have suffered COVID and who are suffering from these long-term symptoms or long-term problems. So this is a very nice thing that I think the patient advocacy groups are doing, and this is kind of, I would say, unique to, but very specific to COVID-19. Yeah, that's all about long COVID that I want to share today. And since this is the last Science Night presentation or Science Night talk, I think Joanna would like to say some final words.
Yes, but maybe questions first.
Okay.
I have more questions.
Okay.
And then I finish it, and everybody can go do their normal life. So I was wondering, is it something that is common to have, like a patient advocacy groups for like other diseases? Is it, because that seems like a great idea, also like for diseases that are, for example, rare.
Mm-hmm.
And now we can take advantage of other tools like social media and so on to put the people in contact and maybe actually help research.
Yeah, so I don't know for sure because I did not look it up, but I know there are like support groups and stuff for many disorders, especially mental health. They do have those. The good thing about this COVID-19, which I found was very interesting, that they are also leading the research and the surveys and like reporting stuff for the scientists, for the medical community. To be honest, I really don't know if in other diseases people have done the same, but this is really nice and good.
Are they doing those Excel sheets?
Very long.
Oh wow.
Huge Excel sheets.
Yeah, that's super interesting. I think that's like really nice, this idea of involving more the community in the research project, because also it will help the science somehow, like the research, but it will also kind of feedback right away, because I think sometimes what happens is that there is a problem in what we, like the knowledge that we acquire and the transmission to the public. That's like the reason why we have Science Night, but it's still like lacking.
Yeah, and I think with social media and stuff, this has become easier. People are able to communicate with each other, share experiences, and then report it back to the medical community. And then these things will be taken more seriously than otherwise, I would say.
Yeah. Okay. Yeah, that was I think my last question. There is a question on the chat. I don't know if you know this person. His name is Deepak. And he asked, is there any data on if certain variants cause more cases of long COVID?
I don't think so.
Because the variants haven't come.
They haven't come. These studies about the genetic variants for long COVID, there have been genetic variant studies for COVID itself, yes. But I have not seen any study coming as of now, or maybe I missed it, I don't know.
Yeah, I don't think it's, so I think the first popping up of these more effective variants came like 4 months ago maximum, and we are talking about 6 months follow-ups.
Yeah, exactly.
So.
And right now most of the data from long COVID is epidemiological, and trying like how many people get this, how many people get that on also. But I'm pretty sure they're coming. These genetic studies and other molecular studies are coming soon, I'm pretty sure.
Yeah. Good. Okay. No more questions? Did I say on it? Do you guys have any questions?
Is there a silver lining? How long does it take? When are we finished with this?
With long COVID or with COVID?
With everything.
Oh my God.
How long to the next?
This is like $1 million question, by the way. If anybody knew the answer, they could make so much money.
Please answer this in 30 minutes. Do like.
I don't know, but I would say that it will take a while.
Okay.
Oh, I need just one more slide, if that's okay, because I just want to send a shout out home. That is a positive message, so everybody can So do you have the slide?
Yeah, I have it on.
Yeah, it's on now?
Yeah.
So I think this slide, I'm not seeing it now, but I think it's like on the left you can see the cases of Germany, and as I said, I think the first week of this series we were like, yeah, something is not going very well, please take care, and then it spiked. Is once again the cases here in Germany and in Kiel spiked, but are now getting constant, so they stop growing, which is good. But on the other hand, we also like, maybe not today that is terrible weather, but when it's good weather, people still need to like think that this is something that is happening, and it's something that I understand, because I feel the same. It's difficult for everyone to take all the time precautions and always have this in their minds, but just remember that in the end of the day, we are really protecting each other, and that's like super, super important, because there are people, and we don't know which people will be, that will suffer gravely from this disease, whether it is when they get it and they get hospitalized, whether it is having very long-term side effects from this disease. So we need to take care of each other. I think on the right side you can also see, I put like a positive message of how many vaccines have been given in Germany, and it's like already it's up to 2 million, right? If I remember correctly.
20 million.
20 million, oh my God. I'm sorry. And it's just like, it's really, really good news. And I hope this number keeps on growing. And if you have the chance to get a vaccine, go and get a vaccine. Talk with your family, so with your house doctor, and if you have the opportunity, go and get it. This is important, so we get to protect each other, and we get to overcome and answer Joe's question and finish this, nip it in the bud. It will forever be in our lives and in our memories, and most possibly in a scientific matter in the population. But it's something that we can definitely control, and this is something that we should really, really aim for. And I would like once again to thank Neha for coming and giving this wonderful talk. I hope to see you in the next Science Nights, talking about non-COVID related things.
No, definitely my pleasure. It also gave me an opportunity to like get up to date on what's happening in the long COVID thing, because we are going to work on it pretty, pretty soon.
Yeah. And also I would like to thank everybody that made this series possible. Hinark for annoying me for months so we could do this, and of course Amrei and Joe for being here, also Joe for trying to film us and failing and losing. But I think in the end this will be on the internet forever. I'm not sure if that's a good idea, but I hope everybody could learn a little bit from what the scientists of Kiel have been doing, and also today what we will be doing in the future. So promise to keep you posted, and let's fight this thing all together. So thank you and good night.